Okay, let's unpack this. We hear a lot about environmental impact from, the big industries.
Hmm.
But have you ever really thought about our own field professional
It's
activities?
easy to overlook, isn't it?
Totally. I saw some data recently. As just the carbon footprint from one international flight. It's quite something.
Yeah.
Makes you think about all those global conferences we or our colleagues attend. What's the collective impact?
That's a really, really good question. I mean, these meetings are vital, right,
Yeah,
for sharing knowledge, collaboration.
absolutely essential.
But yeah, there's that environmental cost just sort of sitting there, often unacknowledged.
Exactly. And that's precisely what we're going to dig into today.
Okay.
We're focusing on the air travel carbon footprint from some recent big global oral health meetings.
Right.
We're basing this on it's a pre-proof article from the Journal of Dentistry. It's called The Air Travel Carbon Footprint of Four Recent Global Oral Health Meetings. Should We Fly Less?
Ah, okay. I've
Yeah,
seen that one. It was quite timely.
it really is. It tries to actually quantify this impact, put numbers on it.
And what's interesting is that the article, it doesn't really question if we should meet, but rather looks at the impact of how we meet currently.
Right.
So our mission here, really, is to pull out the main findings from that study,
Mm-hmm.
and then crucially talk about what it means for us, the clinical implications, maybe the professional implications for dentists.
Yeah, what does it mean in practice, or just for our profession generally?
Exactly. We want to give you a concise understanding without getting too lost in the weeds. Just the key stuff.
Sounds good. And it's important to set the scene, isn't it? This isn't happening in a vacuum.
Not at all.
We're constantly hearing about climate change, the effects on global health. I mean, didn't they just say 2024 was the warmest year on record globally?
Yeah, those reports are pretty stark. Breaking records we didn't want to break.
Right.
And aviation, well, its direct slice of the CO2 pie is maybe around 2.5%, but its overall warming impact is actually thought to be higher, maybe, 4 to 8%, because of how emissions behave way up high in the atmosphere.
Ah, okay. Didn't realize that distinction.
Yeah. So this study really zooms in on how our conference travel, something that feels so normal and necessary, fits into that bigger picture.
So how did the researchers actually calculate this for these specific meetings?
Well, they focused on estimating two things: the carbon footprint from air travel and the total distance flown.
Okay.
And they had to narrow it down a bit because of data availability. So they looked specifically at the presenters and speakers.
Gotcha. Easier to track, I suppose.
Exactly. And they looked at four big meetings in 2023 and 2024.
Which ones were they?
Let's see. The FDI World Dental Congresses, the one in Sydney in 2023 and Istanbul in 2024,
Okay.
and also the IADR General Sessions, Bogota in 23 and New Orleans in 24.
Right, so a good mix of locations across the globe.
For real global spread, yeah. And they basically played detective, using publicly available info, conference programs, speaker lists, websites, anything that indicated where the speakers were coming from.
Okay, makes sense.
Then they used online carbon footprint calculators, air mile calculators, standard tools, really,
Right.
to estimate the emissions that's measured in metric tons of CO2 equivalent, or EMT-CO2e.
MTCO2e. Okay,
Okay.
that's the standard unit.
Yeah, it basically bundles up different greenhouse gases into one comparable number based on their warming potential,
Right.
like converting everything into CO2 terms.
Got it. Simplifies things.
It does. And they also calculated the total kilometers traveled.
Okay, so they crunched the numbers. What were the headline figures? What jumped out?
The big one, the total estimated footprint for just those four meetings, was around 47,000 molid CO2.
47,000. Okay, how big is that really? Can you put that in perspective?
Yeah, the study does a good job there. They say it's roughly the same as the annual carbon footprint of about 10,000 people.
Wow. 10,000 people's entire year. Just from the flights for speakers at 4 conferences.
Pretty much. It definitely makes you pause.
Yeah, that really hits home. That's not a small number.
Not at all. And the distance, total distance traveled by these presenters and speakers,
Uh-oh. How bad was that?
around 325 million kilometers.
Million. Okay, again, perspective, please.
Right. Try this. It's like flying to the moon and back.
Yeah.
About 425 times.
Good grief. Okay, that's astronomical, literally.
It really puts the scale of global movement into focus, doesn't it?
It absolutely does. Did they see much difference between the 4 meetings, or were they all sort of similar?
Are huge differences, actually. Really significant variations.
Yeah.
The FDI Congress in Sydney, the 2023 one, that single event accounted for the lion's share.
How much?
About 57% of the total emissions across all 4 meetings. and 54% of the total distance traveled.
Wow, more than half from just one meeting. Why Sydney? What made it so impactful?
Well, a few things likely contributed. The study did note a general trend for all the meetings more people attend from the host country and nearby regions. That
Yeah.
makes sense, right?
Sure, yeah. Easier travel.
But Sydney, well, it's pretty remote geographically for a lot of the typical attendees, especially those coming from, say, Europe or North America.
Right, long haul flights.
Exactly. So attendees from their high-income regions, who often have a higher travel footprint anyway, likely had to fly much further to get to Sydney compared to, say, Istanbul.
That makes perfect sense. And you mentioned regional distribution. Did that pattern hold up?
It did, very consistently, across all 4 meetings.
What was the pattern?
Higher income regions like North America and Europe contributed disproportionately more to the carbon footprint
Okay.
compared to attendees from lower and middle income regions like South Asia or Sub-Saharan Africa.
And why is that? Just the distance.
Distance is a big part of it, yeah.
Hmm.
But potentially also maybe more prevalence of business or first-class travel from those regions. Though the study was conservative, it assumed everyone flew economy.
Ah, okay, so the real figure might even be higher.
Could be, yeah. They acknowledge that as a limitation.
What about the average footprint per person, per speaker? Did that vary much?
It did, quite a bit. It reflects that location difference.
Yeah.
For FDI Sydney, the average was about 2.5 millant CO2e per presenter.
Okay.
But for FDI Istanbul, much more central, it was only about zero 0.7.
Big difference. Almost 4 times less for Istanbul.
Exactly. And the IEDR meetings were sort of in between. Bogota was around 1.7, New Orleans about 1.4 on average per speaker.
Okay, so the location choice is clearly a massive factor.
Huge.
Right, so we've got this picture now. Significant overall footprint, big variations by location, disproportionate impact from certain regions. Now let's pivot to the so what. For dentists listening, what are the actual clinical implications here? Because, my flight to a conference doesn't directly affect the cavity I feel on Monday morning.
You're right. It's not a direct cause and effect like, say, a new bonding agent failing.
Yeah.
But the study authors argue, and I think it's a strong point, that there's a broader ethical and moral obligation here.
For the profession as a whole.
Yes. For the whole healthcare sector, really. We have a responsibility towards environmental sustainability. Think about it. The environmental problems worsened by these emissions, like air pollution, those do have health impacts. Respiratory issues, maybe even links to some oral health problems, it's all interconnected.
Ah, okay. So it's like a wider public health perspective.
Right.
Our actions contributing to conditions that ultimately affect our patients.
Exactly. Understanding our contribution, even from something like travel, is a first step towards a more holistic preventative approach.
Yeah.
It's about planetary health impacting human health.
So it's about broadening our definition of responsibility beyond just the dental chair.
Precisely. The oral health industry. Think about everything involved. Energy use in clinics, transport of supplies, all the waste we generate.
Yeah, disposables, right.
And as this study shows, travel for meetings and education, it all adds up. So being aware of the footprint of conferences helps us make more informed choices, maybe push for more sustainable practices everywhere.
So it's about connecting the dots. Being more mindful of our environmental impact, even in areas that seem a bit removed from daily practice, actually supports the overall health mission.
You've got it. It's preventative health on a much bigger scale.
And did the studies suggest ways to, tackle this? Strategies to reduce the impact?
Oh, yes, definitely. That's a key part of the discussion. Implications for how we do professional development going forward.
Okay, like what? What kind of strategies?
Well, one idea is promoting more satellite symposiums linked to the big conferences.
Ah, like regional hubs.
Kind of, yeah.
Yeah.
So knowledge gets shared, but maybe fewer people need to make those really long-haul flights.
Makes sense.
And then there's the whole shift towards hybrid and online conferences. That's huge.
We saw a lot of that during the pandemic, didn't we?
We did. And interestingly, the study mentions that some of those virtual conferences actually had attendance numbers similar to the in-person ones.
Really? Okay.
Which makes you question, when is being there physically absolutely essential versus when could a virtual format work just as well, or maybe even better for accessibility?
That's a big cultural shift for us, though. We really
Yeah.
value that face-to-face interaction at conferences.
Absolutely. And there's definitely value there. But technology offers powerful alternatives now. Things like digital posters, online discussion forums. They can reduce the need for everyone to be physically present for everything.
True.
And then there's the simple, but really impactful factor of choosing the meeting location strategically.
We saw that with Sydney versus Istanbul.
Exactly. Picking more central, easily accessible locations can dramatically cut the average travel distance and footprint. And they also mentioned considering things like cost and visa friendliness, especially for attendees coming from lower and middle income countries. Make it easier for everyone to participate, perhaps more regionally.
And didn't they mention a specific example, something at FDI 2024?
Yeah, they highlighted a virtual hybrid symposium on sustainability in dentistry. Apparently, some presentations were pre-recorded, which cut down on travel for presenters. A good model, perhaps.
So different formats are possible. What about individual choices? When we do have to travel.
Yeah, they touch on that too. It's not just on the organizers. Individuals can make choices.
Like what? Flying economy.
Exactly. Opting for economy class makes a difference. Choosing trains instead of planes for shorter trips where feasible. Avoiding layovers if possible, as takeoffs and landings are emission intensive.
Okay. Practical tips?
They even suggested thinking about the timing of conferences, like maybe scheduling them in spring or fall to minimize the need for excessive heating or cooling at the venue.
Huh. Never thought of that one.
Little things can add up. And considering carbon offsetting schemes, although their effectiveness can be debated.
Right. So it's a multi-level thing. Organizers, associations, and individual dentists all have a role.
Precisely. It's a shared responsibility.
Did this study mention limitations? Things they couldn't capture?
Oh, definitely. They were quite upfront about that.
Sure.
Well, focusing only on air travel for speakers is an underestimate, right?
Yeah. Doesn't include all attendees or other travel.
Exactly. Doesn't include local transport, accommodation, energy used by the conference venue itself, food, waste, lots of other factors.
So the 47,000 tons is really just a slice, probably the biggest slice, but still just a slice.
Very likely, yes. And they only looked at 4 global meetings. Think about all the national, regional, specialist meetings.
Yeah.
The true total for the profession is much, much bigger.
Yeah, okay. That's sobering.
Which is why they make a strong call for better data collection in the future.
How so?
They basically say event organizers need to start systematically collecting and, importantly, publicly reporting data on where attendees are coming from.
To allow for more accurate research like this?
Exactly. To really understand the full picture and track progress. They even talk about aiming for, eventually, a carbon-neutral academic conference model.
That sounds ambitious.
It is,
Yeah.
but maybe necessary.
Yeah.
Interestingly, they also look at whether all this flying actually correlated with academic productivity.
And does more flying mean more papers?
Apparently not. They found no relationship.
Huh. Okay, that challenges a common assumption, doesn't it? That you have to travel constantly to be productive in academia.
It certainly does. Food for thought there.
Definitely.
And they briefly mentioned a kind of 3-pronged approach for sustainability in dentistry overall.
What were the prongs?
Policymaking, so influencing regulations and guidelines, professional education, building this into training,
Yeah.
and ongoing research.
So integrating sustainability into dental school curricula, too.
Yeah, seems crucial for the next generation.
Okay, so if you boil this all down, the main takeaway from our discussion, based on this Journal of Dentistry article, is that these big global oral health meetings, primarily through air travel, have a really significant environmental footprint.
That's the core finding, yes. Compelling evidence.
And while the link to my day-to-day clinical work isn't direct, understanding this impact and thinking about more sustainable ways to learn, share knowledge, and collaborate, it's actually a key part of our professional responsibility.
Absolutely. It's about the profession's commitment to broader health, patient health, and planetary health. They're linked.
It definitely makes you think, makes us think more critically about our choices, professional travel, how we engage.
Hopefully, yeah.
So maybe a final thought to leave everyone with, a question perhaps.
Okay.
How can we as the oral health profession, collectively innovate? How do we keep that vital knowledge exchange going, the collaboration that drives progress, but do it in a way that drastically cuts down this environmental footprint? How do we ensure a healthier planet, which ultimately means healthier patients for the future?
That's the big challenge, isn't it? Complex, but also a huge opportunity for dentistry to show some leadership.
It really is. A lot to think about as professional development continues to evolve. And on that note, I think that brings us to the end of this deep dive.